Welcome back to Look Local. Joining me now is Dr. Yazan Khatib from First Coast Cardiovascular. Thank you so much for coming in. Today we are talking about peripheral artery disease, something that's not really talked about that much, but it's gaining more momentum and people are now talking about it a little more than they used to. It's more of a public awareness.
Absolutely.
Wouldn't you say, Doctor?
Absolutely, absolutely. I mean, PAD, peripheral arterial disease, is basically the process of blockages in the vessels. It's no different than the blockages that affect the heart vessels, except here it affects the legs or the carotids or other places, and it carries as bad of a prognosis as the blockages that affect the heart vessels, and it's much easier to detect because it's simply feeling a patient's pulse, and we detect it.
And then we're talking about peripheral artery disease, and you say carotid arteries, such as in the neck, or peripheral means outside of the heart, so like he says, legs. And is it more men or women who show up with symptoms for PAD?
Well, I mean, there is risk factors. If men and women have the same risk factors, then typically women catch up with men by the age of 70 to have an equal incidence, equal chance of having it. At a younger age, women have slightly less chance than men, but by the age of 70, they catch up.
You brought along some videos as well. We'd like to show those, and maybe you can talk us through what we're seeing. Now, what is this, Doctor?
Well, basically, the first video shows how endovascular approaches to fix the vessel work. So in essence, without surgery anymore, it used to be bypass, now we just go ahead and with a simple needle in the groin, after numbing it up, of course, and with moderate sedation, we implant a small catheter, which is basically a hollow tube, okay, no incision, basically a 2-millimeter puncture, and then that tube is advanced up and over from the leg to the heart, or to the other leg, or to the carotid, whatever the destination may be, because the vasculature is all one tree, okay?
So when you say a tube, you're talking about a stent then, basically, that's going to open up that vein, or
the
what?
catheter, the tube, is the first to go in and identify the blockage like the one you're seeing. So typically you see how the vessel looks good on the right and left, but the blockage is in the middle, so we cross that typically with a wire, and then we go ahead and advance a balloon or a type of device that removes the plaque, which we don't show here. But after balloon inflation, the plaque is stretched open. What frequently happens that doesn't show here is that the plaque recoils, and so that's why we implant the stents that everybody hears about every day.
And this is the same type of thing that would happen in the heart if someone's having a heart attack or has plaque buildup on the arteries. It's exactly the same thing. It's just happening, in this case, in the leg.
This example of a fix of a blockage in the legs, as opposed to what you hear about all the time in the heart.
Okay, and the symptoms for this, you say, are that it's easy to detect because all you have to do is check the foot for a pulse or the leg for a pulse?
Well, I mean, many patients, what's really alarming is that many patients have the disease but are not aware of it, okay, do not have symptoms. But typically the classic symptoms are discomfort in the calf when you walk, goes away when you stop, comes back when you walk.
Leg pain.
Leg pain. In more advanced cases, you'll have coldness in the foot, or in really advanced cases, you start to have ulcerations or wounds.
For lack of blood circulation, I suppose.
Exactly, and those are obviously very ominous and really require immediate attention.
Risk factors also, would it be the same for people with heart disease, with smoking, eating, foods high in fat and so forth?
The major risk factors is smoking, diabetes, high cholesterol, high blood pressure, family history, and then there's also, being inactive and obesity. What many people must know is that the risk factors are not just additive, but they actually add on to more, to where 1 and 1 equals 4.
What do you mean?
So if you have diabetes and smoking, okay, together, the risk is more than just the additive risk of diabetes and smoking. There is a synchronous, there is a
compounded.
The compounding effect, exactly. Thank you for the help. That makes, when you have them together, a lot more serious issue than when you have each one alone.
But the good news is this is treatable and can be easily treatable if you find out about it in enough time.
Absolutely. Not only that, an ounce of early detection leads to 2 ounces of aggressive early prevention. Those patients, if they really go on aggressive cholesterol lowering, if they stop smoking, they might very well get to the point where they don't need the stent we just showed before, or they don't end up with a stroke, or don't end up with a heart attack, or an amputation, God forbids. So yeah, it's very, I mean, the outcome is extremely reversible, but it requires the patient to be an active participant in their health care.
Dr. Khatib, thank you so much for coming in today. Very valuable advice.
Thank you for having me. Absolutely.
And also coming up this weekend, we want to pass along some exciting information about a Channel 4 sponsored event. It's the First Coast Health and Lifestyle Expo. You can check it out both Saturday and Sunday at the Avenues Mall. Local vendors will be there to promote healthy lifestyles, some of what we're talking about right now. For more information, you can go to news4jax.com. We'll be right back.